and department services and has played a key role in this treatment. Thank you, sir. I request Jalal sir to welcome them. Dr. Raju Sivasamy to welcome the board. Thank you, sir. Now, next I welcome the privileged person of the evening, that is Dr. Appaji Krishnan, who is a senior consultant of the spine surgery of the Orthopaedic Institute, to give us few insight and present the case.
Good morning, everyone. Welcome to SIMS Hospital. Respected Vice President Dr. Raju, Jalal, our International Patients Services Manager, our dear patient Mersha, who has been with us for last 2 months now in this hospital as our guest and as a patient. So I am Dr. Appaji Krishnan. I am a spine surgeon. Most of you will wonder what is spine surgeon. Actually, there are orthopedic surgeons and neurosurgeons who get specially trained in spine surgery, and we perform only spine surgery as a specialty. So we had this boy, a 15-year-old boy coming from Ethiopia, and we had a tie-up with that government, and this boy was diagnosed with severe deformity of the back. So he had a back deformity which was crooked in the upper back, and in general terms, like it was coined by one of our senior professors, we call it Anaconda Spine, because the spine is so bent, like it says his neck will not be seen before. So to tell what is scoliosis, so scoliosis actually is a Greek term, means there is the spine, if you see from front, should be a straight line, but if you see in scoliosis, they will be with a crooked spine to the lateral curvature, that's to the side. So there is also, so you saw that it's kyphoscoliosis. Kyphosis means exaggerated forward bending. So the people with forward hunchback is called kyphosis. So this is a medical term we use. So scoliosis is lateral bending and kyphosis is forward bending. So this boy had both kyphosis and scoliosis. Normal scoliosis, as we know, is more commonest is idiopathic, where the cause is not known. So if the cause is not known, we call it idiopathic scoliosis, and more commonly it's seen in adolescent age group, especially girls. Girls 10:1 is the boy ratio. So, and there is neuromuscular scoliosis. You would have seen polio patients, cerebral palsy patients. They will also have crooked spine because their muscles are not working properly. The spine bends. Then they have syndromic scoliosis, where there is Marfan's and Ehlers-Danlos, and also this boy who had neurofibromatosis. Neurofibroma is a disease of the nervous tissue. It's a genetic disorder. So maybe his grandparents or somebody had the disease who did not have spine. So the neurofibromatosis is disease of the nerve tissue, but it affects the bone that it starts bending. Even your leg can bend. So this boy had a bend in the spine. So this was him. This is what he looks like. The neck is into the trunk. So this is what we call as anaconda spine. This is how he looked prior to surgery. I think he would have himself forgotten now how he looked, right? So this is what his X-ray was. So you can see at the top end how crooked the spine is. So so you can see there is a huge curvature in the spine which is nearly 110 to 120 degrees. So when you see such high spine, what happens is there is less, you can see the lung space here, there is no space for the lung. So the lung has a backward pressure which exerts on the heart, and you can see the heart, which is supposedly on the left side, has moved to the right side. So there is less lung, there is a back pressure to the heart, which causes heart failure. But luckily in this boy, he just has developed some back pressure in the lung. He came with breathlessness. That was his main complaint, and deformity. So you can hold breath less than 15 to 20 seconds, and then he cannot walk or run faster, but he always dreamed to be a football player. So when we try to do traction film, that's what we try to bend the spine and see whether it is bending before surgery. So there was no movement, zero movement in the spine. So usually, normally when we do a traction film or a bend film, the scoliosis will correct. That is called flexible scoliosis. Here it had become so rigid that it was not bending. Then we sent for a 3D printing. So this is our in-house. We have the department has an in-house 3D printing facility. That's, I think, the only hospital in Chennai which has this facility in-house. So we do a CT scan and send the CT scans to this 3D printer technician who does the printing. So it is like doing modeling, like any model you can make out. This is a synthetic model of his spine. So this was his spine. You can see it has gone there and like a hairpin bend. So this was his spine, and his neck was into his chest. The chest is here. This is the last bone of the chest. You can see the rib there. So this was the last bone of the chest. This is the neck. So neck was actually going into the. So what we decided, because this was so rigid, we put him on a traction. So luckily this boy cooperated. Most of them do not cooperate. So we put him on traction for almost 25 to 28 days. So we hung from his head with this traction, we hung almost 15 kilos of weight. So that stretched his spine slowly. So you can see his neck is coming out in this picture. Then we did the surgery after almost 31 days. So this is after the surgery. You can see how he has got the neck back. He has got the neck length back, and this is the pre-operative. You can see the shoulder and the head are almost same, and here you can see from the shoulder he's got the neck back. And then this is from the side view. So he had this kyphosis, which has become a flat back now. So this was him pre, this was him post-op. So this surgery is actually a very difficult surgery. That's why we were trying to protect it. And it is to be done in very specialized centers where we have very good anesthetists. Dr. Anand is here, I think. And yeah, Anand is our anesthetist who is trained for such difficult, because these are already compromised patients with lung and heart failure. And we do it under something called as intraoperative neuromonitoring. That is during surgery, because we are doing bone surgery, but still the spinal cord is inside the bone, right? So if we stretch it more, the spinal cord can become dysfunctional, like you have seen paraplegics or quadriplegics. So we have an in-house neuromonitoring facility. Dr. Nishant is here, who is our in-house neuromonitoring. He is a MD physiology and fellowship trained in neuromonitoring from AIMS, and he is a faculty in most of the conferences in US also. So we could do this my work was 50%, but their work, the team work, the hospital work was more than 50%, because you saw the 3D printing which was from the hospital, the anesthetist, which is very, very important, and intraoperative help from ION technician. Thank you. Patient is, he doesn't understand English. So he had come with his sister. So sister also doesn't speak much English. But the problem was they had sent the patient to us thinking that he will get corrected within a week, we can do surgery. But this is not a patient where we can do surgery within a week. And she was a pregnant lady at the end of term. And she delivered before the surgery.
insights of this highly innovative procedure. And now I call upon Dr. Raju Sivasamy to give few words.
Very good morning, everybody. We are extremely happy to have a wonderful team of spine surgeon, Dr. Appaji, senior consultant. He has more than 18 years of service in spine surgery, and anesthesiologist, Dr. Anand Shankar, and Dr. Nishant, intraoperative neuromonitoring specialist. With the team of surgeons, specialists, and nurses, and the hospital infrastructure and facility available, we are able to perform this procedure. Mainly, this procedure has been refused by so many centers in Africa and other nearby places, and they have the belief and trust from our center and Mr. Mohammed Jalal, who is the international business head, who has brought this patient to make it happen. I would like to congratulate him for bringing this patient here. He wants to actually, when he came here, when I met him, he said he wants to play. That is the only query he said. He wants to play football afterwards. That is why we took all the steps for him to make it happen. The purpose of surgery is functional, number one. He must be able to walk straight. When you have a scoliosis, there is a difficulty in breathing. There are two structures inside the rib cage. One is heart, another is lungs. If these two cannot function properly, we cannot move forward. Therefore, he is able to achieve the both. Now, lung function is improved. His metabolism will improve definitely. Therefore, he can take more steps and do more work. This is the principle behind it. They have performed the procedure. I would like to congratulate the whole team for the success of this procedure. I want to make the whole society has to know about this procedure is available. We can perform to all as possible. Thank you.
Thank you, sir. So as sir was telling again and again that the kid wanted to play football. So just a small insight about the kid's life. So he was fine. He was fine and enthusiastic and very highly active, and he was very fond of football and all. But until 6 years ago, when his parents started to notice a small change in his spine and all, and that's when they realized that something is wrong with him, and that is when all his dream was actually shut down. Then they approached us, and with all pride, we have brought back his dream again. So we really takes that pride, and thank you all for the dream and all. And next we call upon Mr. Jalal and the patient to just share a few experience.
Good afternoon. Actually, Sims Hospital Orthopaedic Department, one of the best, not in India, I'm sure in Asia, or even in the world, because headed by very experienced. I've been here in Tamil Nadu more than 25 years. I worked before 18 years with Smith and 5 years with Apollo, and 5 years now with SRM. I'm very proud that most of my patients, especially ortho patients, they've been here in Sims. Most of them, they go back happily, and the success rate is very high, actually. And now we believe in God, and we believe in our doctor, actually. Every patient, when this patient, they start inquiring about his treatment, many centers, they refuse to take this patient because it's very, first of all, the risk is very high because it's scoliosis, and moreover also, he's very young and he's growing, and then he have a problem in future for the lungs because his breath will not be there unless something done. Because when he's growing, the lungs is getting tight. So in the near future, he can lose his life. So when the inquiry come from Ethiopia, then we check with our senior doctor. They says let see the patient, because when they send the X-ray, MRI, you're not sure exactly how the patient condition. But they feel that if we can do something for this patient. So when the patient here, we meet the doctor. So Dr. Appaji says, we'll try to give life for this child. We should not just hurry to tell that we cannot do anything. This is a good thing here. We try to give life for the people. So then they said they put him in traction, and we'll see after that if there is chance, because they said he is very actually high risk and anything can happen, and he can lose his also functioning totally. Then he back again, he says, surely we'll do the surgery and surely we'll give him a life back, and we save his life because the lungs is going to be breathed normally and he also can have his normal life. So that assurance make us happy, even sister becomes so happy. Everyone at home, they are very happy that at least we give him chance for life. And now after surgery, when everybody is happy, I appreciate really the management for giving good life for them, because she delivered just now here because nobody can accompany the patient. But she's in the last month. Sari says there is no problem. Like Sari says, let deliver here and we can take care of the child. Thank God and thank the management, thank Dr. Appaji and his team. And we are very proud about India because the treatment in India has become too advanced. Doctors are very good. That's why you can see so many number of foreign patients that come to India to get treatment. And thank India for that also. Thank you so much.
Thank you, sir. And we would like to hear a few words from the patient, Master Mersha also.
Because he speaks only Amharic.
The Ethiopian language is Amharic. So, அவருக்கு வந்து அந்த language மட்டும்தான் அந்த language மட்டும்தான் பேச தெரியும். நாங்க வந்து Google Translate வச்சிட்டு தான் ஒரு தடவையும் அவர்கிட்ட பேசிருந்தோம். So we have a translator also who helps us. Yeah, Mersha.
You see, I'm very well now. It's feeling very nice.
Is he happy?
See, I'm very happy now. Everything.
What was the problem he faced before surgery?
Didn't You see, I'm feeling very proud and thanks to all of you now. You see, before I was not feeling like normal, and now I'm feeling normal and very good. It's proud now. So we want to thank all of you for your support.
Okay, so we wish him all the best too. So we have actually அவருக்கு என்ன சொல்லிருந்தா ஃபுட்பால் விளையாடணும்ன்ற ஆசை. ஃபுட்பால் விளையாடுறதுக்கு வந்து lung was the main problem, not the deformity. Deformity இருந்தாலும் விளையாடலாம், but மூச்சு இறக்கிறதுனால அவரால் விளையாட முடியல. So we had to give him, now he will improve, but he cannot go to sports immediately. We usually say you should go to sports after 6 months to 8 months. ஏன்னா ஸ்பைன் கரெக்ட் பண்ணி ஸ்க்ரூ போட்டது மட்டும் கிடையாது, that has to fuse. கரெக்ட் பண்ண இடத்துல அது நிற்கணும். ஸோ அது வந்து it takes 6 months to 8 months. அதுக்கப்புறம் கொஞ்சம் கொஞ்சமாக ட்ரெயின் பண்ணி you can start playing football. But lung function from pre-operative, முன்னாடி இந்த lung function இப்போ இருக்கிறது வந்து நல்லா இம்ப்ரூவ் ஆயிருக்கு. ஸோ is improved. So luckily heart எதுவும் ப்ராப்ளம் இல்லாமல் இருக்குது. நிறைய பேர் we have done some surgeries, they come with heart failure. So their survival itself is a question. Heart failure வந்துடுச்சுன்னா அவங்களால ஒன்றுமே பண்ண முடியாது. ஏன்னா நீங்கள் lung transplant பண்ண முடியாது, heart transplant பண்ண முடியாது, ஏன்னா இடமே இல்லை செஸ்ட்ல. அவங்க டிஃபார்மிட்டி கரெக்ட் பண்ண முடியாது, ஏன்னா அனஸ்தீசியா ஒத்துக்காது. We have lost patients. They usually இந்த மாதிரி நிறைய குரூப்பர் ஸ்பைன் இருக்கிறவங்களுக்கு ஒரு வயசான அப்புறம் கீழே இருக்கிறவங்களுக்கு பிரச்சனை இல்லை, லம்பார் ஸ்பைன் அதாவது கீழ் முதுகுல வளைஞ்சு இருக்கிறவங்களுக்கு அந்த ப்ராப்ளம் இல்லை. பட் இந்த மேல் முதுகுல வளையிறவங்களுக்கு தான் இந்த பெரிய ப்ராப்ளம். So they usually do not live beyond 25-30 years of age. Slower heart failure வந்து இறந்து போவாங்க. இவர் வந்து he will live his normal life.
ஜெனடிக் டிசார்டரா இல்ல வந்து
இது இவருக்கு இருந்தது நியூரோஃபைப்ரோமா ஜெனடிக் டிசார்டர். ஜெனடிக் டிசார்டர் நியூரோஃபைப்ரோமான்றது வந்து ஒரு ஜெனடிக் டிசார்டர். இப்போ இது கரெக்ட் பண்ணாம விட்டு இருந்தா சொன்ன மாதிரி லங்ல பேக் பிரஷர் வந்துட்டு லங் ஸ்பேஸ் இல்லை. நம்ம லங்கோட பிரஷர் எப்படின்னா ஹார்ட்ல இருந்து பிளட் போகணும் லங். ஸோ ஹார்ட் இப்போ லங்ல பிரஷர் அதிகமாக அந்த பேக் பிரஷர் டு ஹார்ட் வராது. ஸோ ஒரு லெவலுக்கு மேலே போயிடுச்சுன்னா ரைட் ஹார்ட் ஃபெயிலியர் இருக்கும். ரைட் சைடு ஹார்ட் வந்து யூஸ்வலாக லெஃப்ட்ல தான் நம்ம ஹார்ட் அட்டாக் எல்லாம் வந்ததுன்னா லெஃப்ட் ஹார்ட் ஃபெயிலியர் தான் அதிகமாகும். ரைட் ஹார்ட் இவருக்கு ஃபெயில் ஆயிடுச்சுன்னா திரும்ப இதுவாகாது ஃபார் பர்மனன்ட். ஸோ அவர் மூச்சு இறக்காது. இப்போ நம்ம கோவிட்ல செஞ்சதில்ல எஸ்பிஓடலாம் ரொம்ப கம்மியாகிடும். அவங்க கொஞ்ச நாள் கழிச்சு நடக்கவே முடியாது, வீட்டில் கொஞ்சம் தூரம் கூட நடக்க முடியாமல் இருக்கும். இந்த மாதிரி இருக்கும்.
தேங்க்யூ சார்.
சர்ஜரிக்கு அப்புறம் எப்படி சார் ஒரு ஆஃப்டர் 6 months அப்புறம் நார்மல் லைஃப்
கிட்டத்தட்ட 90% ஆஃப் இஸ் நார்மல் ஆக்டிவிட்டிஸ் பண்ணாங்க. அது வந்து வேற ஒரு ஸ்கோலியோசிஸ், அது வந்து இடியோபதிக் ஸ்கோலியோசிஸ்னு இருக்கு. அந்த இடியோபதிக் ஸ்கோலியோசிஸ்ல பார்த்தீங்கன்னா அவரோட மெயின் இது வந்து எதனால வருதுன்னு நம்மளால சொல்ல முடியாது. இப்போ நான் இவர் காரணம் சொன்னேன் இல்லையா, நியூரோஃபைப்ரோமா, அதனால ஸ்கோலியோசிஸ். சில பேருக்கு சிபி இருக்கும், சில பேருக்கு நியூரோமஸ்குலர் இந்த மசில்ஸ் வீக்காக இருக்கும், அதனால ஸ்கோலியோசிஸ். இந்த இடியோபதிக்ல காரணம் கிடையாது. அந்த இடியோபதிக் ஸ்கோலியோசிஸ் பார்த்தீங்கன்னா கேர்ள்ஸுக்கு அதிகமாக வருது. 10 girls is to 1 boy, அதான் ரேஷியோ ஆல் ஓவர் த வேர்ல்டு. ஃபார் சம் ரீசன் நம்ம இந்தியாவில், அதுவும் சவுத்தில் வந்து பார்த்தீங்கன்னா கேரளாவில் இருக்கிற அளவுக்கு ஸ்கோலியோசிஸ் தமிழ்நாட்டில் கிடையாது. மால்டீவ்ஸில், ஸ்ரீலங்காவில் இன்னும் அதிகமாக இருக்குது, பஞ்சாபில் அதிகம், பெங்கால் சைடில் அதிகமாக இருக்குது. தமிழ்நாட்டில் இருக்குது, ஸ்கோலியோசிஸ் இல்லாமல் கிடையாது. பிஹெச்லாம் ஆப்ரேட் பண்ணி தான் இருக்கிறாங்க. ஸோ ஸ்கோலியோசிஸ் இருக்குது, பட் அந்த அக்கரன்ஸ் ஆஃப் ஸ்கோலியோசிஸ் வந்து கம்மி. பட் நியூரோமஸ்குலர் ஸ்கோலியோசிஸ் வந்து ரொம்ப அதிகம்.
Okay, thank you, sir. Before we go to the questions, sir, I'm giving you time. We'll just make this moment more momentous. Actually, since he's a football fan, we would like to present him a jersey and just make him kick the ball into the post, sir.
Yeah, we'll do that. Yeah. சிம்ஸ்லேருந்து மெர்ஷா போட்டு ஒரு ஃபுட்பால் ஜெர்சி பண்ணோம்.
சார் நீ பேர்
கொஞ்சம் நிறைய மாட்டீங்க ப்ளூ ஷர்ட் நீங்க வந்து ஸ்மைல் சரி ஓகே
Come. You hold it one side. Both of you now hold it.
He was holding him all this time.
Yeah, look here, sir.
You want to wear it?
Yes, future Lionel Messi is upcoming.
The sister, she's the one who took care of really home. Younger sister. She's very happy and thank everyone.
Very proud of you, sir. Okay, I guess now we can begin our question answer sessions.
Can you give some photos to us?
Think about
You like doing that? Like that? Sir, possible, sir?
பண்ணலாம் பண்ணாது.
அதான் பண்ணலாம்.